Okay, so this is a chap who presented to clinic a few months back. He has been a runner for quite some time, always suffered with a few sort of lower limb aches and pains, what he referred to as niggles. The main complaint he presented with in clinic when we last saw him was a right-sided Achilles tendon pain, which had been sort of aggravated by an increase in running mileage whilst training for an event, but also a much longer term history of heel pain on both sides, which he'd been previously told was associated with his plantar fascia. So he was seeing myself, the podiatrist, and also the physiotherapist here, a sort of combined joint effect, and we decided to analyse his running technique and his alignment, just to see if there was any sort of mechanical contribution to some of these symptoms. So the video you're seeing here is him running barefoot. We've slowed it down to make it a bit easier to see, and essentially what we're looking for at this stage is the patterns of movement which might be stressing some of these injured tissues. By the time we get to this point, we've already assessed him non-weight bearing, lying on the couch, so we know a bit about his foot mobility, how stiff it may or may not be, and we've done a few standing weight bearing tests, such as standing on one leg and bending his knee, to see how well his foot can control those sort of movements as well. So this is really the end stage of an analysis, and hopefully what you can see is as he's landing on his feet, they rather rapidly internally rotate, so the foot sort of runs through a range of increased pronation. So we look at the left foot as it's landing just here, just rotates to the right, and as we land on the right here, because it rotates toward in a direction toward the left. Now these movement patterns are essentially going to put various internal stresses and strains on soft tissues such as the plantar fascia. It's going to be placed under more tension, so it's going to be elongated with the foot internally rotating, and the Achilles tendon is essentially going to lose a bit of a positional advantage as well. You can probably just make out that it's slightly bowing as he lands on his feet. I'll just show you as he comes through on his right foot here. Just there, the Achilles tendon almost takes the shape of the letter C, a very shallow letter C. So it's our belief that this sort of pattern of movement, coupled with repetitive increased mileage, which is of course usually associated when you're training for an event, is going to contribute quite significantly to some of the symptoms that we're seeing. Management plan would essentially be, alongside physiotherapy rehabilitation, trying to address some of these patterns of movement in the way we feel would be most appropriate, whether that be with a change in footwear, with or without a pair of orthotic devices if we feel that would be appropriate also.